Hi, it's Dr. Regina Nelson with Ask Dr. Reg. Thanks for joining me today. I have a question from Harold in Oklahoma. And Harold wants to know if cannabis might help him replace his blood pressure medication. And I'm going to tell Harold, yes, but be really careful. Make sure that you talk to your doctor. Blood pressure medication is usually something people have been on for a period of time. They get really stable. When they do become a medical cannabis patient, I almost always see that change. And that's good, right? You need less, and less is always better for your kidneys, for your whole body. Your whole cardiovascular system for sure. So if you can reduce your medication, that's great, but you should be talking to your doctor. One, I think they need to understand why your blood pressure is getting lower. And if you talk to them about being a patient, maybe they'll take the initiative to go learn a little more about the endocannabinoid system. And two, they're responsible for managing your pharma, and blood pressure medication is pharma. So don't do it on your own. I had kind of a emergency urgent scare at one time with one of the federal patients, George McMahon, who was a federal patient. The United States government supplied his cannabis for him, but he was here in Colorado, and he was doing so much better on market cannabis at that time. This was about a decade ago, that he quit taking his blood pressure medication because his blood pressure was running super, super low. But it caused other problems because with the Nail-Patella syndrome, which is the reason that he was on the Federal Register in the first place, it's this really weird, rare disease. And it caused him to have some gastric bleeding. He needed to stay on the blood pressure medication, even though his blood pressure was fine. But there were underlying medical reasons why. And again, I'm not a medical doctor. I have a PhD in ethics and creative leadership, so I'm here to help you there. But I became an expert in medical cannabis because I'm a patient. I was sick and I was dying. And I've worked with a lot of patients, and I've known a lot of patients, people like George, who've taught me a lot of lessons. So yes, cannabis can be quite helpful for your blood pressure, but be careful as you wean from blood pressure medication. Work with your doctor or a nurse in their office at the very least, and maybe your best first shot. Go talk to your pharmacist.